Hello everybody, it's Dr. JJ with Pinnacle Chiropractic here in beautiful Bradenton, Sarasota area. We are a local chiropractic practice that really helps a lot of children with sensory issues as well as a lot of pregnant mamas and little babies. But today we are going to talk to you about ADHD. Does your child have ADHD? If they do have ADHD, how do you know for sure? So if the answer is yes, what type of ADHD do they have? Because did you know that there are 6 different subtypes of ADHD according to the diagnostic manual of the medical profession? So when it comes to ADHD, we know that it's typically children that are more easily distracted or confused. And it is confusing for parents and patients themselves to know the question to the answer, or the answer to the question, do I really have ADHD? Does my child really have ADHD? And while the medical profession continues to blame ADHD on, chemical imbalances or genetics, did you know that there's really no medical diagnostic test for ADHD? Instead, what is done is it's about, it's a questionnaire and or a survey, if you will, and they fill it out in about 15 minutes. A teacher or a parent does, and then from that information on this survey or the questionnaire, your child or you have been labeled with ADHD. And then from that, in most cases, they're put on very powerful psychoactive drugs, which have side effects and alter really their whole state of being if it's affecting their psychoactive nature. So while this is an unfortunate thing, it is very commonplace in America, and it's not an occasional occurrence, unfortunately, and it's a problem that lots of parents face. So since there's 6 million children in the United States alone that are diagnosed with ADHD, if you know anyone that is a parent struggling with that, please send them this video, because of those 6 million that are diagnosed with ADHD, over 4 million of them are put on those life-altering, psychoactive, powerful drugs. So essentially, we've got a neurological disorder that's being diagnosed without a true medical test that can say if it is really a chemical imbalance, and if the chemical imbalance is causing the root cause. Also, parents who are also confused and frustrated by the diagnosis in the first place because their child struggles to pay attention and behave well in school or social situations maybe, but then they go home and they can sit in front of the TV and play video games and watch TV for hours with no focus or attention problems whatsoever. So with all that frustration and confusion in mind, let's really unpack ADHD and simplify it so you can really begin to understand the root causes of ADHD and how to really test for neurological dysfunction and the imbalances with the nervous system that cause ADHD. So we'll take all of those 6 different types of ADHD and let's throw them out the door. And so what we're gonna do is we're gonna take those 6 and we're gonna break them down into 2. And I'm gonna make it really simple here. So we have the raging bulls in ADHD, and we have the drunken bulls in ADHD. And it's a lot what you think it sounds like. So the drunken bull with ADHD is someone that is, actually let's start with the raging bulls. That is more the common scenario, so we'll start with them. The raging bull is typically, think about a bull. It is raging, it's at a, the events, the Matador event, let's put that into perspective, where it's just rushing back and forth, high energy, a lot of pent up energy essentially, but this very almost aggressive quality to it. It can zoom back and forth, and it does have some sense of coordination to it. Versus the drunken bull has a similar type of energy. So that type of ADHD is where the child has a lot of energy, but instead of it being more of a controlled action and very high energy, it is almost like they have lack of coordination, and their memories may not be as good as well too. It's just on to the next thing. Very seldom do we see these children remember things well, or even they can forget something the moment you say something else. So those are really the two types. We have someone that's very high energy, more controlled in the sense of coordination, and then we have someone that's, not as necessarily high energy, but still, bounces off the walls, but does it because of lack of coordination, essentially. So now, if you really want to test and find out the root cause of your child's ADHD, determine if they are a raging bull or a drunken bull type, and most importantly, find a drug-free and natural option to help your child reach their full potential, then this video is exactly for you. And that sentiment is the exact same one that nearly 100% of parents share with me today, that they simply do not want their child on medication. That is usually what I hear most of our patients saying, most of my patients saying, that I see that, hey, I don't want my child to have to go on this powerful mind-altering drug. I would rather do this naturally if I can. So if this is someone that hearing that, please let's help them find at least an option to not go down that route of powerful medications. Because while parents get quite frustrated with ADHD related challenges their child goes through each day, they also wouldn't change the world for who they are. So they love their children as they are, but that's taking in all the lumps in as well. So parents want us to really figure out what's causing their children's ADHD. They don't want to change their child. So that comes with, hey, how do we actually test and measure neurology and the root causes behind it? Because your neurology, I've said it in other videos before, but it controls every function in your freaking body. Every function, top to bottom. Your immune system, if I can remember what I'm going to say next, if you can remember what you ate for breakfast, if you can breathe, your heart pumping, you name it, it's the nervous system. So ADHD, of course, is controlled by the nervous system, and whether it is more sympathetic dominant, which would be that raging bull type, or it's more parasympathetic dominant, which would be more the drunken bull type. And so when we have these imbalances with neurology, that's really the root cause of ADHD. So what we have to do is measure it. That's the only specific way that we can actually determine, hey, is this person's nervous system more in a fight or flight situation, or is it more in a rest and digest? So what we're really looking at here is we're going to go way beyond chasing the symptoms with surveys, questionnaires, and medications. And we're going to find out that root cause of ADHD, that neurological imbalance and dysfunction, head on. So this is where our neurological examination and scanning technology comes into play. Now this is one of our scanners. We have multiple scanners in the office, but this is one of many that will measure either inflammation with the nervous system, tension with the nervous system, and overall balance between that parasympathetic and sympathetic state. So typically, this incredible piece of technology helps us find and measure the exact amount of stress that is pent up and stuck in your child's central and autonomic nervous system, leaving it, like I said, in that stuck gas pedal and sympathetic fight or flight overdrive. And that is typically what we see. So when the gas pedal is stuck on, this means that the brake pedal is essentially shut down. They can't do both at once, which we can find and measure with our scans as well. And especially our HRV scans, research has strongly linked HRV and ADHD with lower or suppressed HRV scans. So we do the HRV scan and we see suppressed, it can be an indicator of ADHD, which means that the parasympathetic and the nervous system, the parasympathetic nervous system and the vagus nerve, which rest, relax, and regulate, that's that side of the nervous system, is shut down and not functioning properly whatsoever. So, once we have these scans, we can tell whether your child is number one a raging bull, or number two a drunken bull. We'll be able to determine whether it's one of those two types. of ADHD we classically see. So the raging bull kiddos are the classic case of being constantly wound up, impulsive, and in trouble. And the drunken bull is a kid that you would see may not be hyper, but struggles with focus, following directions, lack of coordination, and overall emotional dysregulation. Many kids do have a mix or both sides, so it's not a hard set thing, just like with anything in life. So we're just looking to see, hey, does it trend one way versus the other? And the HRV gives us a great insight into that, no pun intended, because it is an insight scan. Now, once we have our scans and the ADHD testing back that you'll get when you come into the office, we can then create a fully customized neurological restoration care plan for your child. This is specific for them. It will include different types of adjustments on different types of frequencies based on the severity of the case, and choose just the right amount of what they need versus giving them some blanket care plan going forward. We tailor every care plan to what the child's needs are, including the type of care that we give them. So our neurotonal chiropractic adjustments are designed to do two key things each and every time. Number one is stimulate and activate the parasympathetic nervous system along with the vagus nerve so they can start to rest, calm, and regulate that side of the nervous system, which in turn shut down and slows down the gas pedal mode, the sympathetic side of the nervous system. And overall, what does chiropractic do? Adapts and allows the body to rebalance and organize the communication and the connection between the brain and the body and the busy and stressful environment our kids and you and I live in nowadays. So once this neurologically focused care plan and series of adjustment is put into work over the course of the next few weeks and months, I wanted to say always, but we almost always see raging bull kiddos start to be able to calm down, focus, follow directions, and regulate their emotions. And drunken bull kiddos have more confidence, coordination, and emotional regulation as well. And those kids are the types that you see walk in, and it's like a night and day difference, because that regulation that we have helped restore in their nervous system, it's going to affect your life, the life that your child, the people that your children are around, and it's also just going to make everything smoother and calmer going forward. So if you're wondering whether or not, hey, does my kid have ADHD? And if they do, whether they would be more of a drunken bull or more of a raging bull, then call in our office today and then learn more about what we do here, and schedule yourself an insight scan. Please do. Because that with the help of all this is when we really start to see kids really change their lives, looking deep into their nervous system and figuring out the root cause of your child's struggles. So if you would like them to sit down better, read better, fall asleep easier, these are all things that a lot of our patients have success with after choosing neurologic-based chiropractic care. So I hope that this video finds you well. Please, if you have any questions, don't hesitate to ask. Drop us something down in the DM or in the comments if you see something, or if I said something funny that didn't make sense. I'd be happy to answer any questions for you. If not, we look forward to helping you in the office reach your goals and helping you live a balanced life. Peace and love, and we'll talk to you soon.